Today, we're so excited. We have Dana Saffel with us. Dr. Saffel is a board certified geriatric pharmacist and a fellow of the American Society of Consultant Pharmacists. She also holds memberships in both the American Geriatric Society, the Society for Post-Acute and Long-Term Care Medicine, and the American Healthcare Association. Dr. Saffel currently serves as the Region D representative on the ASCP Board of Directors and is past president of the Georgia chapter and the Florida chapter of ASCP. She is a past board member for the Commission on Certification in Geriatric Pharmacy. Dr. Saffel is a frequent guest lecturer at state and national conferences addressing topics ranging from disease management to business and operational issues for healthcare service providers. Thank you so much for being here today.
Thank you very much. And I'm glad to welcome everybody into our discussion this afternoon. So I'm going to jump right in because the meat of the discussion is going to be as we get to the middle part and work through for the rest of our hour together. So first I'm going to make my computer work, and here we go. So this is me, and we're going to discuss just a little bit about Parkinson's disease. And I'm going to use one particular drug called Rytary as an example when we go to learn ways that you can select a better Medicare plan for you, your spouse, or for your loved one, whoever is the person 65 and older that's on Medicare. And then we're going to really dig into the Medicare programs. We're going to understand the difference between a Medicare Advantage and original Medicare and a supplement and a Part D plan. And then we're also going to look at the changes that are going into effect for 2024. So we'll explore all that, but first, let's just make sure we've got our heads around Parkinson's disease and treatment. I know that here at PMDA, I'll get it in a minute, we have a lot of education about disease state and also about different medications that can be used for disease management. And the core of all disease management for Parkinson's disease, the gold standard, is levodopa. So we are trying to replace dopamine in the brain. And just as you can remember from all the other sessions you may have attended, dopamine is one neurotransmitter out of many that are in the brain, but dopamine is involved throughout the brain, but primarily in the motor function areas of the brain. And when dopamine is lost because of the development of Lewy bodies that kill the neurons that contain dopamine, we have a great loss of dopamine in the brain. And you can see the schematic. A lot of dopamine, you have a normal brain, you lose dopamine, and you have a sick brain. And in this case, you have movement disorders that occur with Parkinson's disease. So the standard treatment is levodopa, which is a precursor to dopamine. And you can give levodopa orally. You can also give it directly into the intestines, but most people take it orally, and they take it in combination with a product called carbidopa. Carbidopa helps avoid the breakdown of levodopa that would occur normally as you digested it. So not very much of the levodopa that you take by mouth would make it across the blood-brain barrier and get into your brain to work. We give it together, the carbidopa, it protects the levodopa all the way through the digestive system into your bloodstream, all the way up to the blood-brain barrier, and then releases it to let the levodopa cross into your brain to do its job. So that's the gold standard treatment for people with Parkinson's disease, and most everybody is on a product of levodopa carbidopa. Now, one of the issues with taking levodopa carbidopa, orally in particular, is that you take a dose and the blood levels will rise as the product is absorbed and carried to your brain. And then when it gets to the very, very top, for some people that may be a tolerable dose, but for some people that may put them at too high of dopamine in their brain for a short while. And then as the dopamine comes back down, it can reach a trough or very low level, and sometimes symptoms of Parkinson's disease can reemerge. So there's a sweet spot in that graph that we're trying to keep people in while they're taking their levodopa carbidopa. And let's see, I think I've got an example. That's the sweet spot. And usually in that spot, you are considered having an on time or a good on time. You'll hear neurologists and other physicians call it on and off or good on meaning that you're in that sweet spot where you're getting active treatment from the disease, from the product that you've taken, and the disease is controlled. Now, that would be ideal if we could keep you in that sweet spot all the time. But what happens in Parkinson's disease is as the disease progresses, we tend not to have good motility in our GI system. We get slowed down and it results in constipation. It can result in food or medications staying in our stomach too long and not even being released into our intestines, and then a slower transit through the intestines. And the end result is you may not be absorbing as much of the levodopa as you would have when you originally started taking it. So we give the immediate release levodopa, carbidopa more often to try to counteract that. So usually we start with 3 times a day, but some people can be taking it 5 times a day, 6 times a day. And as you shorten the interval, you get more spikes and more troughs. And so that's what you see going on here. And altogether, you have less time in that good on period. You have more time where you've got too high of a dose of dopamine, and that can cause dyskinesias, which are involuntary, uncontrollable movements. It could be jerking like this. It could be lip smacking, various kinds of uncontrolled movements. Nobody likes to have them. And then when you get into the off period and symptoms reemerge, if your symptoms are primarily tremors or if it's rigidity, then you will have more of that. So you're not well controlled. And there are things that we can do to maximize the amount of time that you spend in the good on period. So some of that would be increasing the dose of levodopa, or we can have an increase in the frequency of the dose. So you might go from 3 times a day to 4 times a day, which is also going to increase the dose that you're on. We can add an MAOB inhibitor like risagiline, Azilect, or sulfinamide, which is Xadago, is one of the newer ones, the monoamine oxidase inhibitors B, and we can add a COMT inhibitor, catecholamine methyltransferase inhibitor. And COMT inhibitors that you might be familiar with are Comtan, which is entacapone, or talacapone, or which is Tasmar, or you could have the newer one, which is ongicapone, which is Ongentys. So those 3 are COMT inhibitors. And it's not uncommon for people to be on a levodopa, carbidopa, and an MAOB, and a COMT inhibitor. These last 2, the inhibitors, MAOB and COMT, they're basically inhibiting part of the breakdown process that normally occurs in our brain to remove dopamine. Dopamine is broken down into its component parts, and then those are absorbed back into the neuron in normal people, and then dopamine is made again from the component. So breaks down, dopamine's released, it touches the neuron that it wants to signal to, and after it's activated the next neuron, then it was released, broken down by either of these 2 pathways, and then reabsorbed back into the presynaptic neuron. So that helps the dopamine to stay around a little bit longer. So we use levodopa dopamine to increase the amount of dopamine. We give one of these or both of these drugs that inhibits the breakdown of dopamine so that whatever dopamine you have stays around longer. And then we can also add a dopamine agonist. And a dopamine agonist is a drug that mimics dopamine in that it just goes directly to the postsynaptic receptor and activates it. Now, dopamine agonists, we have the ones you would probably be most familiar with, ropinirole, which is Recrypt, or pramipexole, which is Mirapex. And we also have rotigotine, which is Nupro. So that's been on and off the market because of manufacturing issues, but those are the 3 common dopamine agonists. And again, it may be that you may have someone on all 3 of these different classes of drugs to help keep them in good on time as long as we can. You can also use rescue medications if you have an off episode in between your normal dosing. And rescue medications are generally going to be apomorphine. And some of the brand names of different apomorphines that differ by delivery style would be Apokine or Kinmobi or Inbrija. And I think you've had education available through PMDA on all of these drugs. So I'm sure they're in the files if you wanted to go back and learn more about them. But the rescue medication may also be on board, might not be something you use all the time, but you may need to have a prescription filled for that once or twice a year so that you've got a rescue if you happen to freeze up in the middle of your dosing regimen. And then we've got a newer drug, which is an adenosine antagonist, an A2A, and that is eskedefiline, or Nurions is a newer drug there. That's been a relatively new drug into our suitcase of agents that we can use to treat. But we have another thing that we can do to help manage the shortening of the cycle and give you more time and a good own. And that is, we can make some adjustments back to that original drug, levodopa carbidopa. So we have the immediate release that everyone has always started on. There's a controlled release, and the brand name for levodopa carbidopa is Sinemet, and the controlled release of Sinemet is available. It's a long-acting extended release product. It just sometimes takes a while to get on in the beginning because it is a long-acting and it takes a while to dissolve and get into the bloodstream. And some of the tablets, particularly, well, I'll just say some of the generic products that are Sinemet CR or levodopa carbidopa CR can be problematic because they don't absorb out of the stomach very easily. So even though that helps us get some sustained release of carbidopa levodopa, it may not work for everybody. So we have another product that is an extended release. It's levodopa carbidopa extended release. And this product is called Rytari. And Rytari is unique because it's a capsule, number one, which dissolves easier. And it has granules that are of different shape and different amounts of coating. So some of those granules will dissolve immediately and give you an immediate effect when you take the Rytari, and some of those will stay around and be released 2 hours, 4 hours later, maybe even a little bit releasing 5 hours later, 6 hours later, all the way to an 8-hour release. So you can take Rytari 3 times a day and you get immediate benefit and then sustained benefit. And because of its release mechanism, it tends to get absorbed very well in people with Parkinson's disease, even if you have slowed motility in your gastrointestinal system. Now, Rytari is a brand name drug, and as we all know, brand name drugs generally have higher copays or higher costs than generic drugs. And if we looked at some average people with Parkinson's disease, you can see here, and this was back in 2022, what the typical yearly cost for medications are in Parkinson's disease. Now, this is with different Medicare plans. So this is people that are insured. So with the new changes to the Medicare program, we have the ability to choose a plan that would limit how much we're going to pay for brand name drugs and generic drugs throughout the year. So we have an ability to limit our outlay and not have to pay these very large expenditures over periods of time. And that's what we're going to talk about today. So Medicare has an open enrollment period every single year from October 15th, which was just a few days ago, to December 7th. And you will be doing yourself a disservice if you do not look every single year to see if you should be changing your plan. Now, you can save, and this says it, but it's true, you can save thousands of dollars by selecting a different plan. It's human nature that once a person chooses something, they don't change. Where object, in motion stays in motion, and an object at rest stays at rest. And by golly, the majority of people on Medicare stay in their plan. people that are recently retired or they're retiring now and have to apply for Medicare, many of them are getting notices from the company that they used to work for. And they're being offered a Medicare Advantage plan. Perhaps it's by the same company that provided your employer benefit. Don't just take it. Take that information and then do research, because oftentimes your employer is getting a rebate or a benefit, or the company that provided you that information is getting a rebate or benefit from the plan to sign you up. And it may be the best option for you, but it may not. So just be an educated consumer and check everything out on your own before you select. So original Medicare versus Medicare Advantage. A Medicare Advantage plan will always be your least expensive option, but it will always limit your care. You may be able to live in an area where the limitations to your care still meets your needs. It still may be all the doctors you want to see. It may cover all the drugs. It may provide you the level of care that you need. However, if you plan to travel, or if you want the freedom to be able to choose any physician anywhere in the country that takes Medicare, or if you think you may need to do that in the future, then original Medicare is what is the best option for you. And I will tell you that both the government and all of the commercial insurance plans that offer a Medicare Advantage plan, everybody wants you to choose a Medicare Advantage plan. The Medicare Advantage plans by commercial insurance want you to choose it because they're making a lot of money from the government. They're getting subsidized for the cost of your care, and then they're getting additional incentivized payments from the government to offer you all the things you get with Medicare Advantage. But Medicare Advantage plans don't pay as much money for some services. So I'll give you an example. If you're on Medicare Advantage and you need to go into a rehab facility for Part A covered rehab stay, a Medicare Advantage plan will pay on average $385 a day to the facility. That they have to cover all the cost of your care, your meds, your therapy, your diapers if you have them, your bandages if you have them, your food, everything has to be covered out of that $385 a day. Original Medicare would pay close to $600 a day. What do you think the nursing home would prefer to have? Someone with original Medicare or someone with Medicare Advantage? And Medicare Advantage may limit how many days it will pay for your care. If you qualify for a nursing home rehab stay, your benefit under original Medicare will pay for up to 100 days if that's how much time you need to achieve your therapy goal. But Medicare Advantage may say, we're only going to cover you for 14 days. I know this is true because I have worked in the long-term care industry and have seen the disparity between Medicare Advantage and original Medicare. And this is what you don't see. They also pay physicians differently. So if you want the best option to have flexibility to go where you want to go when you need to go, then that's original Medicare. But if you have limitations in how much money you can pay, then a Medicare Advantage may be the best option for you. That's the gist of what we're going to say. Now we're going to show you how to figure out what kind of plan you need to be in. So this slide is a great slide, and you can look up this information in a variety of places, but this is original Medicare, which is Part A and Part B. And Part A is free. That as long as you have worked and paid Medicare taxes through your employer for at least 10 years, then you and your spouse get free Part A, which is hospitalization and up to 100 days in a skilled nursing facility. If you need rehab, it pays for hospice care and it pays for home health care. And there's no premium for Part A. Part B, which you also have to sign up for if you choose, covers your physician visits. It covers medications that you may receive in a doctor's office. It also covers preventive services and medical supplies, durable medical equipment. So if you are getting home health care and you need an IV drug, for instance, you could get that at home, and the pump and the drug that goes through the pump would be covered under your outpatient durable medical equipment benefit under Part B. We have to pay a premium every year for Part B. This year, it's been $165, but next year it's going up to $175. And you pay that premium whether you are in original Medicare or a Medicare Advantage plan. You'll pay that exact same Part B premium. And then if you're in Medicare Advantage, which they also call Part C, Medicare Advantage plans, nearly all of them offer services, the hospitalization coverage, your physician's office coverage, and then almost all of them also cover a drug benefit. And many Medicare Advantage plans will also offer dental and vision benefits and sometimes gym memberships. So it sounds like a really good deal. However, you got to read the details, because they may say they offer dental benefits, but then you find out that it's only partial coverage, and even then only certain dentists are in the plan. So maybe your dentist may not be in network. So again, you've got to dig deep. You should always make a list of all your current drugs and any drugs that you think you may start next year. You should also make a list of all of your physicians, all of the hospitals that you think you may need to go to, because and even guesstimate in the future. For instance, if you think you might get cancer, if you have prostate cancer or breast cancer in your family, and that's something that you might have a risk for, and you might want to know whether or not you could go to MD Anderson if you needed to go to the very best cancer place, or another one if that was in your area. And you need to make sure that where you need to go is going to be covered by the plan. So write that down too. This may not apply to you, but just be as prospective in writing down your needs as you can. So if you do not choose a Medicare Advantage plan and you have chosen original Medicare, then you will need to choose a Part D plan so that your drugs can be covered. And then you will also need a Medicare supplement or a Medigap. Original Medicare plus a Medigap will then provide coverage for all of your Medicare and your copays, so that you don't have, or co-insurance. So you pay just the premium for original Medicare and the premium for your Medigap insurance, and then you don't have to pay anything again. It covers your copays, your deductibles, and all of that. And the Part D benefit is going to be slightly different than the Medicare Advantage plan and the original Part D. So we're going to get and discover that a little bit more. Now, these are the commercial plans that are most commonly chosen for the Medicare Advantage plans. And you've probably already been getting bombarded by various ones of these plans that operate in your state. Not every plan offers something in your state. And that's something to remember, because if you select a Medicare Advantage plan and you like to summer in Ohio and winter in Florida, or summer in Montana and winter in Arizona, you need to make sure that Medicare Advantage plan actually will cover you in both places. Or maybe you have 3 homes. You need to make sure it will cover you in all 3 places. It will always choose where your main address is as where your home is. Where you list that for your tax purposes and everything. Your main address is your home, but you need to also make sure that plan provides coverage when you go other places. A Medicare Advantage plan prohibits you from being able to buy a Medigap plan. So once you choose a Medicare Advantage plan, you cannot be in a Medigap plan. And Medicare Advantage plans do not cover you if you go out of the country. Medicare Advantage will only cover you in country. So if you like to travel overseas, or if you like to just go up to Canada or down to Mexico, then an original Medicare plan with a Medigap plan would be a better option, because the Medigap plans, generally, depending on which one you choose, will cover you when you're out of the country for emergency care. Now, there's a $50,000 lifetime limit on that emergency care, but they will pay for your doctor or prescription or even a hospital stay if you were to have a serious injury while you were out of the country. Medicare Advantage plans will not cover that. And so if you have a Medicare Advantage plan and that's the best choice for you, and you do want to travel overseas, then you need to buy travel insurance to cover your health while you are out of the country. And those are widely available as well. My husband, after he retired, I created a travel agency, because all I do, I think, is create. I figured he was retired and he wasn't working enough, because I'm still working, so he wasn't working enough. So I started a travel agency. And so, yes, travel agencies can help you select a travel insurance that will provide coverage for cancellation of your trip, as well as coverage for emergency medical care if you need it, if you have a Medicare Advantage plan. So there are options. All right. So we've got to make decisions on what the best plan is for us between now and the December 7th. And if you've already selected a plan, and after today's program, you think you may want to change it again, you can change your plan as many times as you want to before December 7th. So if you already went ahead and signed up for the plan you used to be on, because that's just what you always do, and you decide now you want to do a little more research and may select a different plan, you can do that. So you're not locked into anything right now. So we have to consider all your drugs, all your doctors, the hospitals you might want to go to, and hospitals that you think you might need to go to, or maybe you feel that you want to go see a movement disorder specialist when the only thing you've had available is a general neurologist in your area. And if you're willing to drive 2 hours or maybe fly to another city, you might be able to see a movement disorder specialist. You need to make sure that physician is also covered under your plan. So include that person's name, even if you don't even have an appointment yet. You want to be covered. And then you're going to look at what the premium cost is, what the deductibles are, both for, well, we know we all pay the now $175 for Medicare Part B. You also want to look what your drug cost premium is, what the deductibles are, what the copay is, and any other payment or limitations that may be associated with that plan. And then you put all your doctors, hospitals, everything in. And let's see. This is a comparison of what they cover. And this comparison actually came from Medicare.gov and also some common newspaper articles, one that was in the New York Times. There are things that are put out by the Kaiser Family Foundation. They all say essentially the same thing, and it's not all completely in there. So networks. Original Medicare, you can go anywhere in the country to any doctor in the country as long as that doctor takes Medicare. So if I want to go to MD Anderson for cancer care, if I want to go to Cleveland Clinic for heart care, if I want to go to the Mayo Clinic for something, I can go get on a plane, fly anywhere to the best specialist I have found or heard of. I might want to go down to a Parkinson's disease center of excellence, of which there are only 6 or 7 in the country. They're affiliated with the university, may have to fly there. And I want to make sure that I can go anywhere I want to go. So I'm going to pick an original Medicare. If you happen to live in a metropolitan area where access to all of those services are available in your area, you may find a Medicare Advantage plan that has all of those doctors in their network. But it's very important to make sure of that, because in-network costs are very low if you're in a Medicare Advantage plan, but out-of-network costs can be as much as 100%. So some of the facilities that I named a few minutes ago, which are like the havens of the best care for certain conditions, a lot of them aren't on all the Medicare Advantage plans. And if you need to go there, then you have to pay 100% of the costs. And you can't get a Medigap plan to fill in the difference. So be prospective. Now, there's no additional out-of-pocket cost after you hit a threshold in both Medicare Advantage and original Medicare, but the threshold may be different in Medicare Advantage plans. Also, as I mentioned in my example, access to durable medical equipment and to home health care and to nursing homes, and even access to some physicians may be better under original Medicare than it is under Medicare Advantage, because original Medicare in general pays more money for your care than a Medicare Advantage plan does. And then with original Medicare, of course, you've got to spend more money. You've got to pay for original Medicare, $175. You've got to pay for a Part D benefit for your drug coverage, which could be anywhere generally from $0 to $100 a month for a premium. And then you may have copays depending on your drugs, and you may even have a deductible, which is an amount of money you have to pay cash out of pocket before the plan starts to pay. You're usually going to have a much less expensive drug benefit under Medicare Advantage. Usually there's 0 premium, 0 deductible, and your copays are usually low as well. You have to also pay a Medigap insurance, which if you get it when you first choose Medicare, that Medigap will be in general, it depends a little bit on what state you live in and what your whether you're a male or a female and whether you've smoked or not. But those are the only three things that a Medicare Gap plan can use to figure out the price for your Medigap insurance if you select it within the first 6 months of turning 65. You go on original Medicare, you have 6 months to select a Medigap plan. And then basically everything is covered. There is a problem though if you've been on a Medicare Advantage plan. If you've been on a Medicare Advantage plan and you selected a Medicare Advantage plan and you discontinued your Medigap plan when you did that, because it's a lot less expensive as an outlay on a yearly basis, as long as your doctors are covered by that Medicare Advantage plan. If you decide you need to change back to original Medicare, you may not be able to get a Medigap plan. That's kind of the hook. So you have the ability every year in the open enrollment plan to change from original Medicare to a Medicare Advantage, or from a Medicare Advantage back to original Medicare and get a drug benefit. You can do that every single year. You can go back and forth during that open enrollment period. There are some special enrollment periods, such as going into a nursing home and while you're in the nursing home and coming out of the nursing home, or if your Medicare Advantage plan goes out of business, or if you move to another place and that Medicare Advantage plan isn't offered there, then you have these special enrollment plans that you can either choose another Medicare Advantage plan or choose original Medicare. But even with those special enrollment periods, once you are out of the first 6 months that you were in Medicare, or if you happen to have chosen a Medicare Advantage plan, they give you 12 months. That's the only time you can switch back to a Medigap plan and get that guaranteed coverage at the lowest cost. So if you are on Medicare Advantage and you decide that original Medicare might meet your needs better, but you are 70 or 75 or 80 years old, then you may not find a Medigap plan that's willing to cover you, or they may require that you pass a physical, and they may be unwilling to cover any pre-existing conditions, which Parkinson's disease would be a pre-existing condition. So that's why if you're young to Medicare, it's better off to try to select original Medicare and the Medigap plan if you can afford it, because you have the greatest options of care. If you are already in a Medicare Advantage plan, then you have to consider what the cost it would be, and you should contact a Medigap to see if you can get insured by the Medigap plan before you change back to original Medicare. because you do not want to be in original Medicare and not have a Medigap plan, because you will have a 20% co-insurance on every service, hospitalization, doctor's visits, that can be quite expensive. So I think I've beleaguered that enough, but I just wanted you to know all the things that aren't really mentioned in this slide. So the Part D plan, let's talk about that for a minute. It's the drug benefit. And even if you're going to stay in a Medicare Advantage plan, you should still go on Medicare.gov. And I'm going to show you what to be doing, how to manipulate that website in just a moment. But you want to compare Medicare Advantage plans and make sure you're in the best plan for you. And that can differ every single year, even if your meds didn't change. Even if your meds were, just Rytary this year, and it's going to be Rytary next year, the plan you're in this year may be not the best plan for you next year. It might be 3 or 4 down on the ladder of best plans. So you may need to change, and it's super easy to change. You can actually enroll right there in the best plan for you, right on the website on Medicare.gov, and everything will be done from there, and you'll receive the cards for your new plan in the mail. And whether it's Medicare Advantage plan or whether it's just a Part D plan with original Medicare, that will all, whatever change you've made by December 7th will go into effect on January 1st of next year. So deductible, copay, co-insurance. Difference between copay and co-insurance. Copay is a fixed amount of money, usually $0 to $5 for a tier 1 generic, maybe $5 to $20 for a tier 2 generic. A tier 3 preferred brand will be maybe $40, maybe might be $45. And a tier 4 preferred brand might be $50 or $60. And then you get to specialty tiers. And often if a drug is in a specialty tier, it has to cost more than $500 a month to make it into a specialty tier. But a lot of insurance plans will then start charging you a co-insurance. So you'll be paying a percentage of the cost of the drug, not a fixed amount like you do with a copay. Again, these are things to look out for. And then out-of-pocket costs. So in 2024, there's going to be a change in Medicare. The first 3 portions don't change from what it is this year. It's that 4th catastrophic period, which is in 2024 going to be anything over $8,000 in drug spend. And that $8,000 includes what you spend plus what the insurance company has spent on your drug. So you don't have to be $8,000 out of pocket to get into the catastrophic phase. That happens with the combined how much you've paid and how much the insurance company has paid. When that equals $8,000, it used to be up until next year, 2024, that you had to pay 5%. That's all, you had to pay 5% of the drug cost. Now, because of the Inflation Reduction Act, in 2024, the Medicare Part D plan and Medicare itself will cover 100% of the cost of drugs in the catastrophic phase. Many of you who are on brand name drugs for Parkinson's disease will reach the catastrophic phase. If you're just on generic drugs, you'll never reach it. But if you are on brand name drugs, most of you will reach the catastrophic phase with Parkinson's disease. And so it's nice that now when we reach that, we no longer have a copay or co-insurance. So I want to switch. I think this is the slide that I want to do it. I want to switch to, let me see if how I can get out of here. Hang on, I got to get out of presentation mode. I want to, let's see, what I want to do is, maybe I can do it here. Don't want to end the show. I may require help. I thought I could do this, but they've changed. Maybe
can you try pressing the escape
right,
key?
I got it done. All right. So guys, I am going to type in where I want you to go. There are a lot of places that advertise that you can search for Medicare drug plans on their website. understand that anywhere you go, you have the likelihood of being advertised to, or they are likely to position one type of plan over another type of plan because they're getting paid by the health insurance company to promote their plans. The one place you can go that you will get unbiased information is Medicare.gov. So let's see. All right, I'm going to do www. Let's see if I can get it to type. www.medicare.gov. All right, now, so when you go to Medicare.gov, if you haven't been there before, you can go to log in and then you can open an account. And I highly recommend you do that, because then going back and forth year to year, or anytime you want to go check anything, all of your data will be in there, at least regarding all your drugs. So you don't have to log in to use it though. So I'm going to just go and say, I'm going to go to health and drug plans. If you go to basics, this is just information about Medicare. You can find out just about everything that was in the slide deck on Medicare. If you want to look for care providers, doctors, hospitals, nursing homes, you can go to them under here, or durable medical equipment can go under here. We're focusing on drug plans now. So go to drug plans, click find health and drug plans. Now you can log in here, or you can create an account, or for today, we're not going to. We're just going to search without looking at anything. So here, I'm going to put in a zip code, and I want to look for coverage in 2024 because we're making decisions for next year. So I put in my old Atlanta zip code, and I lived in Fulton County. Now I live in Florida, but me and everybody else has retired to Florida. But we're going to look in Atlanta because it's a much bigger area. It has a lot of different health plans you can choose from. So the next thing you have to do is select, do I want to look at a Medicare Advantage plan, or do I want to look at a Medicare drug plan? You can also look for Medigap plans. So if you are considering original Medicare, you want to look at your Part D plan to make sure it covers your drugs. And then you want to also look at a Medigap plan and then call the plan to verify they would cover you if you're switching from Medicare Advantage to original Medicare. If you're within your first 6 months, then you know you'll be covered. So first I want to look at Medicare Advantage. Unfortunately, you cannot compare Medicare Advantage plans directly to Medicare plans anywhere. And everybody positions Medicare Advantage plans first, even the government, which is the most unbiased site. But the government, they would like everybody to be on Medicare Advantage plans because it's a fixed amount of money for the government. So if everybody on Medicare was on a Medicare Advantage plan, the government would be able to budget exactly how much money they would spend every month for their Medicare population. With original Medicare, they don't know if you're going to have to go to the hospital this month, or maybe you need rehab care next year. They don't know that. So they can't budget as well for it. They can only do historical budgeting. So just be aware, Medicare Advantage plans always gets presented first. And so now I'm going to say, do I get any additional help with my cost? If you get Medicaid, if you get Social Security income, you can click on that. But if you get regular Social Security, that doesn't impact it. But if you are getting a lower rate or getting it because of disability, that will impact how much you pay. A Medicare savings program, extra help from Social Security, you can put I'm not sure, and it will lead you to more questions. I'm just going to say I don't get any help from those programs to make it simple for our little bit more time we have today, 15 more minutes. And I want to give you some time for questions as well. So do I want to see my drug cost when I compare plans? I'm going to say yes. And the next thing it's going to do is it's going to ask me to type in the name of the drug. So I'm going to use Rytari, since we talked about it today, as a easily absorbed, sustained release form of levodopa carbidopa. And so I'm going to, it gives me two choices. So if you misspell something, chances are you'll see the right drug when the choices come up. I'm going to click on Rytari. I'm going to say add drug, and then it's going to default to the most common dosage form. But if you click the arrow right here where I clicked it, then all the dosage forms come up, and you can put your exact dosage form in there. I'm going to leave it on the default because this is the one most commonly used. It will also default to the most common quantity, but if you take a different quantity, you can change it. For instance, if I was getting it filled every 3 months, a 3-month supply, I would say 180, and then I would click quarterly or every 3 months. But I'm going to leave it 90 once a month now. I'm going to add to my drug list, and then I can add more drugs. Right now, I'm just going to say I'm done adding drugs. And then the next thing you can do is select the pharmacies that are available in your zip code. And this is important. You might always go to the same pharmacy, but you should select some pharmacies close by, because the cost difference is noticeable between what one pharmacy may charge and another pharmacy, because different pharmacies are in network for different plans. So always pick your pharmacies. I'm going to have a mail order option. I'm a clinical pharmacist. I detest mail order. I think you need to have a relationship with your pharmacist. They're very, very helpful, but a lot of people select mail order. I'm going to select Kroger and CVS. You can select up to 5 pharmacies for your comparison at a time. Okay, and that's as simple as it is. Now, these are Medicare Advantage plans. There are 61 Medicare Advantage plans to look at in the county that I used to live in Atlanta. I've got them showing 10 at a time on a page, and I've sorted my plans by lowest drug and premium cost. You could make it by lowest yearly deductible or lowest health plan deductible or lowest monthly premium, but these are the 4 choices you have for filtering, and this is the one it defaults to. So I know right now that AARP Medicare Advantage from United Healthcare, the Georgia plan, shows up as #1 of being the most affordable plan for me for Rytari. So I pay 0 monthly premium. I do have to pay my $175 drug Part B premium. Zero premium. It does say here doesn't include the standard Part B premium, so you are still going to have to pay $175. It will give you what your drug and premium cost is for the entire year of 2024. Now, if you were selecting 2023 because you were starting in Medicare in November 1st, for 2023, it would just give you your drug cost for the 2 months of 2023, November and December. So it always calculates when your Medicare would start and gives you the remainder of the year. But for 2024, it's given me the full 12 months. This is what I would have to pay for Rytari under this plan, AARP Medicare Advantage. I would pay $1,140 for the whole year. If I went to see in-network doctors, the maximum I would have to pay would be $5,900. If I went to an out-of-network doctor, it would be $9,550 if I went some in and some out of network. These are estimates, though, and they do tell you they are estimates. So what else does it show me? It shows me what the plan's benefits are here: vision, dental, hearing. They also cover over-the-counter drugs. They also cover home safety devices and modifications to your home. But these are all with limitations, so you have to give even deeper to make that decision. We're not going to dig into health plans from a health coverage, but let's look at drug coverage. So both CVS and Kroger are in network. The mail order is in network and preferred. And you can see the difference if you were to go to either CVS or Kroger, you're going to pay the same amount of money, $1,140. If you get it through mail order, you're going to save $300 in the year. And this tells you that you're not going to enter the Medigap, the catastrophic coverage gap, because you've got to spend the total of $8,000, and your spend plus what the health plan is spending isn't that amount of money next year. So you won't enter the coverage gap. If you entered the coverage gap, though, if you did enter it, your cost would be zero because you don't pay anything for drugs in the coverage gap. This is what your monthly cost would be. And you can see here that the mail order requires you to get a 3-month supply. That's your cost for 3 months each time. There's a lot of information you can get here. You can look at things here. This is provider network. Oh, by the way, so this was the overview. This is where we were. I'm still on AARP Medicare Advantage. You can look at benefits and costs. So you can see that you can see a primary care doctor in the network for nothing, for zero. But if you go out of network, you've got to pay $30 copay per visit. If you go see a specialist, and a neurologist is a specialist, depending on whether they are in network, you may still have to pay a $35 copay. If you go out of network, you've got to pay a $55 copay per visit. And there's no way to get that reimbursed if you're in a Medicare Advantage plan. Diagnostic tests and procedures, you have to pay copay. Labs, you do not have to pay copays. So if you recall, this plan said it offered dental and vision coverage. Well, it does offer coverage, but you have a $15 copay for some of the dental. And then different copays down here, this amount. So just because it looks, and I know I'm making you dizzy to spend this like this, but because it looks like you don't pay anything, you will pay if you have to go to a specialist or if you need more extensive care than just living in your home. So it's very important that you look at all of this. Now, we looked at drug coverage, the extra benefits. For instance, a hearing exam, it's nothing if you go to an in-network, but it's $55 if you go out of network. And fitting fees, which are the most expensive fees by an audiologist, are not covered. So it says it offers hearing and vision and dental benefits, but you've got to dig into all of this and see the limitations apply here. Always click on. So you can't find out on this website what the exact limits are. You've got to call the plan. So before, if you're selecting a Medicare Advantage plan, before you select the plan that you feel offers the best benefits, call them and ask them what their limitations are on dental, vision, and hearing. In my area, the closest that anyone is in any one of these Medicare Advantage networks is a 45-minute drive for me. My dentist, my ophthalmologist, they are not covered by any of these plans networks. So is it really worth it if I've still got to pay these $55 copays and such? Now here, dental, this looks like a pretty good plan. But comprehensive, if I need a bridge, then I may have to pay something here, up to 50% co-insurance if I need a bridge or a tooth replacement. So I know I'm making you dizzy again. I want to go back. So let's go back to search results. That's an example. The best pick for the lowest cost, if the only thing you take is Rytari on that Medicare Advantage plan, was Medicare Advantage from AARP. I want to show you that if we go back and just add something like a generic drug. So I'm going to add another drug, and I think I'll add ropinirole. It's an MAOB inhibitor. And we'll just leave it at the default, add to my drug list. and I'm done adding drugs. All I've done is add a generic, which should not cost me anything. I'm going to keep my pharmacy, so I'm going to say done. And we're still on Medicare Advantage. Now remember, AARP came up as the best price if the only thing I took was Rytary. But if I added just one generic drug, look at all these that actually come in less expensive. In fact, AARP is not even showing up on the first page. AARP, look at this, all these plans. I have to get to the third page now. I believe it's the third page. I checked this before we got on. There it is. On the third page, it was the #1 plan, best for you if the only thing you took was Rytary. But now you've got a drug deductible that you didn't have before and more expensive copays. Go figure that. Isn't that strange? So you need to add every single drug you take, every prescription drug you take. And since they don't check what drugs you're putting in there, go ahead and put in all the drugs you think you might take next year. If you usually have a bout of bronchitis and maybe you take a Z-Pack, go ahead and put in 1 Z-Pack a year. Just put everything in, because you may find that the plan that showed up as your best deal when you put the drugs you're taking today may not be the best deal with drugs that you expect you might need to take. And if not, you've got time between now and December 7th to go visit your doctor and talk with him or her and say, where do you think, what would be the next logical medications you might need to add if my disease or my loved one's Parkinson's disease worsened next year? What would you add next? I'd like to get a list so I can make sure my plan covers it. That's the way to be prospective. And then come back, add all those drugs in again, and you just go back to drugs. You can add a drug at any time. I'll add another drug. Maybe I'll add, I'll pick on, I had a dopamine agonist with, or I had ropinirole, dopamine agonist. Maybe I'm going to add rasagiline. That's another common one. Rasagiline. Let's see if it changes again. So we've added this drug and done adding drugs. And I'm done with my pharmacies. I think I hit it accidentally. Done adding drugs. Come here and hit done. And in just a minute, look, it's a completely different order again. Cigna showed up on top this time. But I'm still having to go down through Cigna and Humana to get to that AARP that covered me best when the only thing I took was Rytary. So now I hope you get it. I want to go back. So close your eyes. I'm spinning back to the top. This is tough when it's online and you can't control the spin. So I'm sorry if I'm making you dizzy. I want to go back to drugs and pharmacies. And I want to, I'm going to say that I am done adding drugs. We've got these 3 drugs now. I've done adding my pharmacies, and I want to change my plan type. So there are different types of Medicare Advantage plans. I did not limit it. I could have limited. An HMO is an HMO, like Kaiser Permanente. You can only go see their doctors at their facility. HMOs are great if you happen to live right next door to the HMO, but most of the time we want to see people that are not in the HMO. So you want to go with either a preferred provider or PPS. But I had just checked Medicare Advantage and I got all of them. You could just select one if you wanted it. But here I'm going to pick original Medicare with a Medicare Part D plan. So I just want to look at Part D plans. There are only 21 Part D plans down here that you can select from. And for me, with the drugs, the 3 drugs that I put in there, then Humana Basic RX plan is the best for those 3 drugs. And you can tell right now that I'm spending a lot more money to be an original Medicare than I would be in a Medicare Advantage plan. I'm going to pay a higher monthly premium. I'm going to have a drug deductible, and my drug costs are going to be higher. Shows the difference between retail and mail order. And unfortunately, you cannot compare a Medicare Advantage plan to original Part D side by side. So when I get to these, and I think I have found the best plan for me on both Medicare Advantage and original Medicare Part D, I'll print them off and compare them back and forth. And then I'll think, does that plan that shows up as best for me also cover me all the other places I go in the United States? And does it cover me if I go out of the country? And does it cover all drugs I need to have in the future? If I go back, I want to show you that just going back to drugs and pharmacies, and if I remove rasagiline and remove ropinirole and say I'm done, and now I'm back to just Rytary again, and it's whatever you selected, it does remember that. So it remembered that I am in original Medicare with Part D plan. I still have Humana Basic RX plan as being the best for cost. But look, this is a $45 deductible. There is an option for only $20 deductible. But that was looking at total cost. This is the yearly total cost if you go to a retail pharmacy, and $2,227 is if you use mail order. So here, my monthly premium cost is a little less, but overall, I'm going to spend more money if I went with Cigna Medicare Saver. And you can go to, well, this is where if you chose to enroll in a plan different from what you're in, because if you don't do anything, you'll stay in the plan you're in for next year. That's 70% of people on Medicare tend to do that. Even though the price may go up every year and you may be paying more and more, you may find your drug has switched from being a low-cost copay to a high-cost copay. And you won't realize that till you go to the pharmacy in January. But you can look and see if that's still the best plan for you. If you want to enroll, you can click this enroll button and enroll right here on the website. If you want to know more information about the plan, all the details, who to call, what their phone number is, it's right here. And you can go to the plan's website. You can call if you're not a member, or if you currently are a member. You can call the plan, ask them anything you want to ask them. If you want to view the drug costs, like we did with the Medicare Advantage plan, here they are. So you'll meet your deductible in February. That's the $545 you have to pay out of pocket before the plan starts paying. You won't enter the coverage gap with just Rytary in 2024. But look, there are some differences. Well, there's no difference in these two pharmacies. Sometimes there are differences in the cost between CVS and Kroger, or CVS or Walgreens and Publix. So they both will be in network, but there may sometimes be a change. And you may decide that it's worth driving a mile further and changing your prescriptions to a different pharmacy because they contract better with that plan. So again, always dig down into this level of detail. All right, so I think we're actually 5 minutes over, and I feel very bad for that. I'm going to go back to here. The only thing left that I was going to share with you, this is an example of a bunch of different Medicare plans and how the cost for drugs, this is a Part D plan. These are all Part D plans. PDP is prescription drug plan, and MAPD is a Medicare Advantage plan with a prescription drug plan. You either want a PDP with original Medicare or an MAPD, a Medicare Advantage plan with a drug plan. And basically, these are, I'm going to leave it on this slide. These are different Medicare programs that or government programs that are good sources to get information, unbiased, that would let you have access to learn which is the best plan for you. So I know we're over, maybe everybody's already scooted out, but if you haven't, I'm happy to stay and answer some questions for you if you have anything.
Perfect. We do have a few questions. Someone asked about whether or not we can input vaccinations.
You can input vaccinations. Medicare, original Medicare and Part D cover all the vaccinations that are commonly available in the United States. So, and Medicare, whether you get it at your doctor's office and it's covered under Part B, or you can get it at the pharmacy and it's covered under Part D, for the COVID and the flu and the RSV, I believe the hepatitis vaccines, they're available at no cost to a Medicare beneficiary, whether you're in original Medicare or Medicare Advantage.
And then another question was about whether or not the cost and the medications are fixed for the year. Like, for example, if somebody was on Rytary, put it in, goes with this plan based on the input, can they then in March say, oops, we don't keep Rytary anymore? Can that happen? Or is it sort of like a contract that you can't break?
Okay, so that's actually two questions. The first question is, can the price change? Yes, the price that you see on Medicare.gov per prescription can change. That's an estimate based off the prescription cost today. And there are small increases in price throughout the year. So it might change a little bit, but not significantly. But what a plan cannot do is they cannot change the way they cover Rytary. So if when you're making the decision, Rytary is covered and it doesn't require a prior authorization, they cannot take it off the formulary, non-cover it in the middle of the year. They cannot automatically start requiring a prior authorization if you've already been on the drug and you made that decision for that plan based off their coverage that they're showing you right now. So they cannot, they can increase the price slightly if the price from the manufacturer goes up, but they cannot change what they're covering or how they're covering it. Unless they change it from being a high cost copay to a low cost copay, they can do that. They usually don't. Now, if a drug is available as a brand name drug at the beginning of the year and it's being covered, and that drug becomes available as a generic drug in the middle of the year, then they can choose not to continue to cover the brand name drug unless the doctor writes a medical letter, a letter of medical necessity. There's always ways to get around if a plan tells you they're not going to pay for your drug. I think I did that on another call. There's always ways to pay for it, but it is a headache for you, for the doctor, and it's a headache for the plan actually, because it can take 3-4 months to get the plan to agree to pay. But if you need something and your plan doesn't cover it, then don't take no for an answer. No is the first rung on the ladder to yes. And you may have to climb up 8 or 10 rungs before you get that yes, but don't give up.
Somebody, there were a few questions about this. If you had a Medicare Advantage plan and the provider dropped Medicare, can you switch over to Medicare without new underwriting?
No, you have to switch providers. So even if there is not another neurologist or movement disorder specialist or another primary care in your area, and the one doctor in your town has decided he's not going to take Medicare anymore, then that is not an impetus enough to allow you an open enrollment period to be able to switch back to original Medicare. Only if you move out of the territory where the Medicare Advantage plan is. Now, if you move out of territory, if you're in a Medicare Advantage plan and you really want to go to original Medicare, and you move out of the area where that Medicare Advantage plan covers you, you can apply for original Medicare and a Medigap policy, but the Medigap is not always guaranteed to cover you at the low rate. They may have to cover you, but the rate might be $500 a month instead of $160 a month, because they know one of the reasons you're changing back is that you're a risk, a health expenditure risk.
We're running out of time. One more question though. Somebody asked, I just lost it. Does copay coverage from patient assistance programs count towards the $8,000?
So patient assistance programs have not historically counted. I think I've got some patient assistance programs that are here. The amount the patient assistance program covers does not get reported to the government in any way, and therefore it does not count towards your true out-of-pocket expenditure, sometimes referred to as TRUE, but it's the amount that would be counted as going towards that total of $8,000. So if you're getting foundation coverage and the foundation runs out of funds halfway through the year, as it does sometimes, then you'll have to start picking up paying at the original coverage threshold all the way until you hit that catastrophic threshold again.
I lied. One last question, because I thought it was a good one. Someone asked, how much time should I be spending on this? Because in my head, I'm like, yeah, I could totally, with my OCD, spend over 100 hours on this. And like, I understand that I'm like, probably more than an hour, but what would you say is like, if you're spending like 10 hours on this, would you be like, that's too much? You're overthinking it, or?
Yes. However, if you have not gone to this website, medicare.gov, if you've not been to that website, if you have not played around and pulled things up and dug deep into it, if you have never called a plan that you have never belonged to before and started asking these questions, you will need to spend more time doing that. So it would not be unreasonable to sit down right now, today, tomorrow, this weekend, sit down and get familiar with Medicare.gov and spend an hour. Then close it down, load all your drugs in, all your expected drugs, load all that, save that drug list. You've got your account. Next time you sign in, that's already done. It remembers you, your drugs, and the pharmacies you selected. Next time you sign in, spend an hour, hour and a half. And don't spend an entire day at a time. You will get exhausted. You'll be brain dead. You won't be able to remember whether you were looking at Medicare Advantage or whether you were looking at original Medicare. I would look at Medicare Advantage plans only the one time. The next time I'd look at just original Medicare, if that's an option for you. And remember, the differences in original Medicare is that the biggest difference is you can go to any specialist or any general practitioner that you want to. You don't get limited to just a network. And more hospital systems are limiting which Medicare Advantage plans they belong to. So if you go to the nearest hospital, you may have to pay an out-of-network price to be there. The drug benefit will always be less expensive on a Medicare Advantage plan, but they may not cover your drug. So take it in little chunks, little hour and a half at a time. Sit down. If you find something you think is good, hit the print button. It'll print off. It'll be probably 15 pages, but it'll print that plan off, staple it together. And then if you printed off several plans, then you can go back and compare when you're not on your computer screen and just kind of flip pages, because you can hit the print button and everything that was on the Medicare.gov for that plan will print off.
Someone did suggest you should just move to Sweden. It's a much simpler option, but I'm thinking the language barrier could get to people.
Well,
anyway,
my personal trainer I work out with did move back to Sweden, and she absolutely loves it. And actually, all of the Netherlands have great healthcare. They just pay 60% taxes. That's what you get.
Thank you so much. This was incredible. I do encourage people to save their chat. There's 3 little dots on the bottom of their chat because we did put a few links like SHIP and like Medicare.gov. So we encourage you to do this. This came up a lot. Yes, this will be available tomorrow. Great info. Thanks for all these tips. And we're so glad you could be here today. Thank you, Dr. Saffel.
It was my pleasure. I hope you all got some good information out of it.
Bye, everyone.